Yeah, so good afternoon. This will be the second part of Argentum nitricum. To add a little to male, characters of Argentum nitricum is where you have impotence in that remedy where erection fails when the poison is attempted, and there is a want of desire. Okay, so to compare the agnus castus, the desire is absolutely nil. Caladium as well as selenium have intense desire. Okay. Going to the female part, sensation of splinter in or about the uterus when walking or riding. We have already discussed that this sensation of splinter runs throughout the remedy, and it is there in the throat when swallowing, as you can see in dolichos, silesia, hepar, as well as such remedies. So there is a sensation of splinter not only in the throat but also in the uterus when walking or riding. And there is a coitional bleeding that you can see, and there is a painful coition, and there is a post-coital bleeding that you can see, again that you can see in nitric acid as well. Now post-coital bleeding is a normal symptom also. It can happen after normal sexual intercourse. It can be a symbol of some pathologies happening inside, like some kind of beginning stages of cancer. It can be just because of a polyp that can happen in a cervix or endometrium. It can happen even in postmenopausal woman, so that can also have a postcoital bleeding. Here again, metrorrhagia, another important symptom of this remedy, can happen in young widows, can happen in sterility, and even in the menopausal time. Okay, nervous erethism and change of life. So that is another symptom you can remember about Argentum nitricum. And painful affections of left ovary. Now again, Argentum met, Argentum nitricum, platina. You can think of lachesis. All these remedies have a left ovarian, affections. Gastralgia, and that can occur at the beginning of menses. Okay, so some symptoms that speak of your female part of Argentum nitricum are these. I think the most important things should be sensation of splinter. There is a post-coital bleeding as well as metrorrhagia. All these three symptoms given in the keynotes. The others are from Boric. Okay. In the respiratory side, you already studied Argentum met, which have this problem of voice and all. Now here there is chronic laryngitis of singers. The high notes cause cough, a very important frequently asked question in APGT. The same symptom you can see in Illumina, Argentum met as well as Arantrophyllum. Okay, so just one line symptom we already discussed. There is kind of hawking and all. And in CNS you have some symptoms specifically related to your spinal cord. Okay, so there is some weird symptom where if the person is not observed, okay, then the person walks and stands unsteadily. Okay, so when he is observed, he tries to be normal, but when he is not observed, when he thinks that he is not observed, he walks and stands unsteadily. Convulsions preceded by great restlessness, great weakness of lower extremities, because we already said that there is an emaciation of lower extremities. There is also weakness of lower extremities with trembling, cannot walk with eyes closed, as you can see in Illumina, even in Zelsium also, I guess. So what I want you to remember from the chapter of Illumina that we have already discussed, this is again a brochure for that. It is Romberg's sign positive. Okay, so when a person can walk in a straight line or walk normally without swaying and all with open eyes, but at the same time if you make the patient close their eyes and tell them to do the same, just to walk, they might stumble or sway a little bit, which indicates there is some kind of lesion in the CNS part. So you have to identify that is a Romberg sign, and you can see that in sensory ataxia, which again have to differentiate from cerebellar ataxia. So sensory ataxia has a positive Romberg sign, whereas cerebellar ataxia has a negative Romberg sign. And sensory, again, you have to remember some conditions that you can see that can show your Romberg sign is vitamin B12 deficiency, which can ultimately lead into this subacute combined degeneration of spinal cord and all. And there is some conditions like posterior spinal cord syndrome, something related to your infarction of spinal artery and all. Okay, so I just want you to remember some parts of medicine also along while you read these remedies. Please remember those things also. And now Boric have mentioned such terms which we have to understand the relation between these two. So please read the last 3 points: paraplegia, myelitis, and disseminated sclerosis of brain and spinal cord, posterior spinal sclerosis, post-diphtheritic paralysis. So apart from the last point, the 4th and 5th point speaks why there is inability to walk with closed eyes. So that will make you understand why Boric is a clinical materia medica and why Allen's is some terms that you have to mug up. But clinical materia medica, you have to understand there is some kind of logic that Boric have said. Okay. Yeah. So in sleep you have dreams of snake and dreams of sexual gratification and other symptoms that is taken from Boric. And coming to the last part, modalities, you have cold food, ice cream, eating sugar can cause diarrhea and all. Unusual mental exertion can bring up diseases in Argentum nitricum. Warmth, because Argentum nitricum is a it's a hot patient, so they doesn't like warmth. They have night troubles, and there is a left-sided affection for Argentum nitricum, because left ovary has been already said that. Amelioration, because these people crave open air, so they are better by open air, bathing in cold water. Eructations and pressure, so they have this headache, which is better by tight bandaging and pressure and all. And eructations, I think they will have the sense of relief after passing the air that is built up in the abdomen, so flatulence will be better by passing the flatus. Okay. And in the relations, the antidote for abuse of Argentum nitricum, especially on the mucous membrane, the topical application of Argentum nitricum, if such abuses have occurred in the patient, the best antidote should be natramur. Coffea increases the nervous headache. Okay, so that is something that you have to remember. After Argentum nitricum, there is a caution to prescribe coffea. And some complaints that is seen in boys after using tobacco, just like that you can see in R-Salb as well as Veratrum, is given in Argentum nitricum. Again, tobacco complaints is a very big list that you have to sit and make a list of it. And last but not the least, lycopodium follows Argentum nitricum well in flatulent dyspepsia. So you have some indications, guidelines to follow while using Argentum nitricum. The abuse can be tackled by natramur. There is a caution for prescribing coffea because it can increase nervous headache. And for flatulent dyspepsia, after Argentum nitricum prescription, you can think of lycopodium. Again, those lycopodium and argentum are hot remedies. Both have GIT affections, so you can think can become a differential remedy. Question for you people is, the trio of craving sugar does not include sulfur, lycopodium, Argentum nitricum, silicea. So the answer is very simple. It is silicea. Okay, the all three, sulfur, lycopodium and Argentum nitricum, are the trio of craving sugar. Muscle refuse to obey their will is seen all except. Okay, yeah. So it is Asterias rubens, alumina, Argentum nitricum, and gelsium. So the answer should be Argentum nitricum, because all the three other remedies have this direct lines in Allen's keynote, whereas you can see the exact line in Argentum nitricum. Okay, but please remember, cannot walk with eyes closed. This will come alumina, argentum nitricum and gelsemium. Again, we discussed that is your Romberg sign. Which of the following has the description of stools like chopped spinach? Okay, so the stools are described as chopped spinach. So you have a list of remedies and you have to pick which are the remedies that have this description. So I would like you to remember such descriptions, because these are the identifiers from your question. The question will be weird in Mitra Medica because you don't know from where the question comes. You have to pick some things that can help you identify what is the answer. So one such thing is your chopped spinach. Now chopped spinach can be seen in Argentum nitricum as well as chamomilla. So the answer should be 3 and 4. That is your answer, D. Okay. So just to remember, it's chopped spinach, so it should be green. But then since the description is chopped spinach, I want you to remember 3 and 4. But if the question is green, then I think some other remedies also will come up here, just like your podophyllum, maca as well as veratrum alba. These remedies also have green stools. Okay, so I think that's the end of the session. Thank you.